Hi, I'm Jeff Groh and welcome to Gravity. This month is snowboarding. So we're going to take a look at a very dynamic activity coming down the mountain. We're going to break it up into two sections again so that you have a progression of activity so that we can periodize the approach to our training programs and really take a look at the snowboarding as a function. How do you move down the mountain? We're moving in the frontal plane in a direction, but we're using the transverse plane to drive us and turn the board. So when we take a look at some of the injuries that are out there, the CDC reports over 55,000 people receive treatment related to a snowboarding injury. So that's a whole big clump of people. Now, when you take a look at the details of those injuries, you get a lot of head injuries, you get a lot of shoulder injuries, even teeth get knocked out, cervical spine, the acromioclavicular joint gets jacked up, and I have had all of those. So I'm coming to you live with scar tissue and all kinds of stories. So I've both had mild concussions, broken humerus, or broken wrist, all kinds of stuff. So I'm going to try this program before I start snowboarding next time as well. The big group of people that are in there are children. There's a lot more children that try snowboarding than adults. As a matter of fact, only 10% of that 5 to 15 million people that go up and down the mountains on snowboards a year are over the age of 35. So there's not a giant market, but it is growing. So there are some opportunities for children's programs, for youth programs to get them ready for the preseason or the actual ski season. So our goal is really condition the body to respond better to the environment with functional principles and strategies that will help to avoid some of the falls, some of the trauma-based injuries, because when you look back at those injuries, most of them are falling back, most of them are catching edges, trauma. Now we're going to try to focus on getting that proximal strength again and being able to avoid those things with a little bit more intrinsic control before we hit the slopes. So we'll start off with the bunny slopes. That's our readiness program, and progress right into the black diamond program, which is going to have more of a progressive functional demand that matches up snowboarding. Welcome to the Black Diamond. We're up on top of the mountain now, bigger incline, still looks sunny to me out here, but we are progressing through our program into the next stage, which is more or less the pre-season. So you're about four to 6 weeks out from taking your big trip to the mountain. You've got a bunch of kids or a bunch of young adults or older adults, whoever, who bought into this snowboarding program, and you're ready to progress. So we're going to build on the same strategies. Our goal is to build on that foundation that we built up in your bunny program or the bunny slope program, and again facilitate an environment where we can prevent those falls from happening, to prevent injury, where we get stronger in the trunk, where we get stronger in the ability to turn, we get stronger in the ability to stop, which can be very important with snowboarding. Kind of a tough little skill there, so I always say take some lessons as well before you start down the mountain. So our principles are still the same. We've still got full body movement, we've got a tricky ground reaction force, we've got three-dimensional movement, and we know that this is a driven movement. Just like pretty much everything, something's going to have to drive us to turn. We can't just think about turning and then we turn. Something's got to facilitate that. So if we're going to try to do a top-down approach, we might turn the body one way, which drags the pelvis, and you saw that story in number 1, which is going to get us to turn. So our strategies for the Black Diamond program are to increase this whole dampening or the shock absorption. So we're going to talk about more of the plyometrics. You can see the plyometrics in the first session. Still incorporating these plyos, but also building on more of an isometric strength for just a moment, and then coming back up. So we'll do those drop and holds from a plyometric. We're going to work on more frontal plane stability, getting the hips out, and really looking at movements that are going to drive the body in the transverse plane. So although we're going down the mountain in the frontal plane, and although we're going to call it a transverse plane or a sagittal plane movement, or if I'm going to go into hip extension, what that's going to do is it's going to drive the hip in the sagittal plane, but it's going to drive the rest of the body in the transverse plane. So it's kind of tricky to see, but obviously if you're going to drive the hip back, you're going to get a rotational product out of that. So you're going to get a rotational, basically as you drive the arms or the elbow. Why don't we start over? As you drive the hip back, it's going to rotate your body. Thanks for being patient. Now we're going to go into also some hip extension, flexion. All those things are going to drive the body in the transverse plane. And we're going to start with our technique. So we need someone to help us out, and you know who it's going to be, right? Because she's our champion of gravity this season is Nicole. She's going to take the hit again for us. So we're going to talk a little bit about the warm-up. If you want to see the full warm-up or just an abbreviated version of the warm-up, check out the bunny slope video with snowboarding, because what it is, it's a lot of cardio pull, it's a lot of variations of the cardio pull, and then introducing some plyometrics. So we're going to...
It's in skiing, right?
It's in skiing, you're right, skiing. So skiing, bunny slopes, you'll see that whole variation. We're going to start off still with some plyometrics because we're going to add weights now. That's our big progression in the plyometric drops or the plyometric hops. And what this means is we're going to have our feet in a what's called a right foot forward, left foot external, right foot internal, wide base. And she's going to come down in that, explode back up, and decelerate down. Now here's the progression. We're going to add 24 pounds of resistance to Nicole. So she can just hold these tight to her body, or if you want to get fancy, you can start to do like a chest press or something in the meantime, make it a little bit more dynamic, even going back and forth with the arms. So those are going to introduce all these perturbations to the body from the top down when we're doing a bottom-up driver. So just going back and forth, rotating, that's all right.
Lots going on here.
Exactly. Now close one eye. So good, we're doing lots of good things. I'm looking for good knee tracking, making sure that we don't see a lot of frontal plane instability. Might be an idea for me to kind of capture one-on-one with this client afterwards. Looking at the degree of dorsiflexion, so I can see she's getting a nice lengthening through the posterior calf, the hip muscles, the glute muscles, everything's getting turned on. And then if she starts to fatigue, we can do an exhaustion set. I just take one set away and she continues on. So we can do little tricky things like that. It's a very simple way of progressing. I'll go ahead and take that back from you. I know you got a lot to go. So get creative with that. Use unilateral movements, use weights, use anything that you can to increase the intensity challenge for that movement. What we're going to do now is go into what's called a reverse crunch. So we're going to take off the squat stand to create a little room. I'm just going to get this out of the way. And we'll keep the level at the same. You can lower it to make it a little bit easier or raise it to make it a little bit harder. You can also do the reverse crunch with the foot holder. You can have them grab that. A lot of clients don't have that strength to be able to maintain that, to be able to hold their body weight or a percentage of their body weight up. So you can simply just use the back of the glide board as a fulcrum in order to create this movement. Now what this movement's for is to get the abdominals to be able to pull the hip forward. We're going to go into a reverse crunch, but add kind of a unilateral rotation. So I might just have her start with her hips and knees real tucked in and just really just coming up to where the sacrum comes off the board, just a small movement, introduce that to them. And then you start to drive in the transverse plane. So I might have her drive her left knee up to my hand here and drive the right knee across to here, back and forth, knees together. And again, this is nice rotation. Is that your ankle or your shoes?
My shoes.
Good. And then we might extend the hips out a little bit more to get a more eccentric lengthening of the hips and do that same thing. It's going to add all that weight out on, it's kind of past the center of gravity, so it's going to get more and more intense. And then eventually we go all the way out to extension and then come up. So it's really kind of load and explode. So the hips and abdominals all involved in getting those hips decelerated and transformalized into a concentric explosion of activity. So those will help to facilitate kind of that right knee or left knee drive in that transverse plane to get them to the snowboard to be able to turn. Okay, so that's our reverse, that's a bottom-up approach. Now we're going to go up to a top-down approach. So we're going to go back to that torso rotation. So we're going to link in the pulley system. We've got our friendly military hovering above, watching over San Diego. I'll have you take these and then I'll drop it down quite a bit. How's that?
Good.
Good level?
Yep.
Okay, so we probably only need one of these, don't we?
Yep.
I'll take this one back. And this is the way I can really trick her. I can get into some dynamic movements. So we started in bunny slopes with a traditional bilateral torso rotation. This time what we're going to do is we're going to take a friend away. So we're going to add in a little more intensity with the right arm. The posterior shoulder complex is all going to have to lengthen and decelerate so I can really see nice scapular abduction. It drives across and it's a friend to the trunk. So your posterior shoulders helping out some of those oblique muscles, everything's working together to really drive the upper body around so that you get that board to turn. Now we switch hands so that we get both sides. Now you get the pectoral muscles, which are best friends with the external obliques. You look at those fibers all lined up, and they're working together to achieve torso rotation. So she's got double drivers here with a load on the left arm. Lots of variations with angles, incline variations, decline variations. We can also drive her, put her into a flex position, which is going to be a little bit more like snowboarding, and drive back and forth. So you get more specificity to that sport to get more of an adaptation to that specific environment. Next one I'm going to do is have her just take that handle and put it down. We're going to do the same thing, but add more dynamic loading. She's going to be we'll stagger the knees again. And what we're going to do is just create a little different stimulation by having her catch and bring it back to me. So I'm going to throw it I'm not going to tell her what side. I might even head fake her a couple of times. So I'll just start off nice and light, have her rotate back and forth. Her whole body's got to adjust to this dynamic load coming through. And then I might have her bring her knees just a little bit closer together, and you'll see that it doesn't take much. It doesn't take much. I don't want to be unsafe here, but I just lighten the load a little bit until she adapts to it, gets a sense of it, and then I can start to throw a little bit harder, and then I can really just whiz it at her. I wouldn't do that. So that's a nice little variation to the trunk rotation. And then we're going to go into, we've kind of gone into this flexion, rotation. Now we're going to go into that extension again to try to get that hip to drive back through that plane. So we're going to get her back into a prone position. We're going to add that squat stand, because what that's going to do is allow us to increase the demand for the upper body strength. Now you can also do this without this and just have the client's feet on the lower base. And I'm going to accommodate for upper body by starting in a fairly high angle. So this will make it a little bit easier as it's higher. So you're going to be in a plank position, and we're going to trick her by bringing her feet all the way up top to the top of the squat stand. Now you can see that there's a little ridge here. She feels fairly stable. I should check with that. Do you feel fairly stable? And this is a big, high bridge, very dynamic, advanced position. Maybe we'll drop the hips just slightly. And what she's going to do is take one leg and drive it in that transverse plane and really open up the front of the hip, go as far as you can, and then go all the way around to the other side. So just an amazing exercise for stability, the upper body, and you get the nice opening up of the hip. Everything has to stabilize. You're getting the glutes fired to drive that up against gravity, back and forth. And it's a really, really fun thing to do, is to start to open up the glide board now. And I don't know if that's appropriate right now, but we can create more instability, which is going to create more stability in the body. So it's a fun movement. Try it basically with your feet on the ground first, and then build up to the squat stand. Nicole's a trained athlete, so we can play around with stuff like that. So these are just some ideas, again, to get you to think about snowboarding in a functional capacity, to be able to create functional programming. You can obviously create 100 different exercises using the GTS, and I sure like to fuse other products like the medicine balls and weights, all to make it more and more functional for that sport. So thanks for joining us for Gravity This Season Snowboarding.